Hello, good people. My name is Edwin Getaukibe. I am the director at Uhai Center. At Uhai Center, we offer consultancy services on mental health issues with particular interest on alcohol, drug, and substance abuse. We do prevention programs, we do treatment programs, as well as rehabilitation programs. We are based here in Thika. You are welcome anytime you need our services. We are in the month of May, and in the month of May, we have set aside this month to create awareness, to psychoeducate on mental health issues. When we talk about mental health includes our emotional, our psychological, and social well-being. Mental health affects our thinking, mental health affects our feelings, mental health affects also the way we act. Mental health is very important in all stages of our life, from childhood, in the adolescence, and also in the transition to adulthood and adult life itself. Mental health determines the overall health of an individual, the socio-economic development of an individual, and the entire community. Mental health also affects our lifestyle. Mental health affects our physical well-being. It affects how we relate with children as well as how we relate with adults. Mental health affects our employment and even our productivity and our earning. In short, what we are saying is mental health, without mental health, there is no health without mental health. It's very important in this month to discuss what causes or what are the factors that influence mental health disorders, mental health wellness. Mental health influences various outcomes of an individual. It influences outcome of a community. Remember, mental health is the one that determines our lifestyle. Mental health determines our physical well-being. Mental health as well determines how quick, how fast we recover from illnesses. Mental health also affects our productivity. Mental health affects our earnings and also our productivity in the society and the economic development. In this month of May, I would want us to have a look at what are the factors that influence, what are the factors that contribute, what are those issues that bring about the mental wellness or the mental disorders or the mental challenges that we encounter in our day-to-day lives. And some of the factors that bring about mental wellness or mental disorders or mental sobriety is the psychological trauma. You'll find there are those people who have encountered so many psychological challenges in their day-to-day lives, bringing about stress and depression. We have also the issue of the environmental stress, where you are living, who you are living with, the people around you, the surrounding. All these factors contribute largely on the effects or the consequences of your mental health wellness. There is also the aspect of genetical inheritance, hereditary. Some of the mental challenges that we encounter, they are things that we get from our forefathers, from the lineage in our families. So it is very important to know that our mental health is determined by our thoughts. Our mental health is determined by our emotions and reaction to the feelings. Mental health is also determined by behaviors and the interactions that we have amongst the people who we are living with. But still, the social component cannot be taken for granted. The economic component, the political atmosphere, all these are determinants of how well our mental health will be maintained. So it's very important to bear in mind that even the environmental factors that are surrounding will determine how well you cope with the challenges that are within and near you. Mental health and mental health disorders are determined by one's thoughts, they are determined by one's emotions and the feelings that affects our day-to-day lives. The behaviors and also the interaction that we have with other people are also determinant on our mental wellness. It is important to mention that we have had a lot of stigma and a lot of discrimination for persons with mental health issues. When I talk about mental health issues, alcohol, drug, and substance abuse is among them. We have a lot of human rights that are violated for these people. We have indecent living conditions for persons with mental health issues. We have these people who are subjected to unhygienic and very unconditional living standards. In this month of May, it is very important to mention or to create awareness or to sensitize the public that persons with mental health conditions, persons with alcohol, drug, and substance use disorders, persons with these mental challenges, they undergo so many challenges. Among them, their human rights are violated, they are stigmatized and discriminated, they are denied economic rights, they are denied cultural activities. It is also noted that they are subjected to unhygienic and inhuman living conditions. Majority, they are physically abused. Majority, they are also sexually abused. It is good to note that there is help for these people who are facing such challenges, and that there is treatment and maintenance of persons with mental health conditions. Having talked about mental health and mental health challenges, mental health disorders, alcohol, drug, and substance use disorders, it is very important now for us to ask ourselves, what is our expectation? What are we expected to do? What are our priority, or which are our action areas? Number one, promote mental health in all socio setups that you are within, be it in your family, be it in your school, be it in your workplace, or even in religious institutions. Let us preach and promote mental health. Let us embrace that mental health is a disease which has prevention, treatment, as well as management, and people can rehabilitate, can go back to their normal lives. That is bullet number one. Bullet number two, it is very important to prevent. Prevention is always better than cure. Let us prevent, especially on alcohol, drug, and substance abuse. Let us be good role models. Let us show the way to our children. Prevention is the only 100% sure way of managing or containing alcohol, drug, and substance abuse, as well as other mental health challenges. If that fails, then there is treatment, then there is management, then there is a way we can rehabilitate this person who has already been affected. Let's have avenues. How? By identifying the accredited institutions, by identifying competent personnel, competent caregivers, because so many people have commercialized this counseling, this treatment, this rehabilitation. Let's look for right people who are worthy giving the services. Number four, it is all about treatment and rehabilitation. Remember, do not stigmatize, do not talk ill about those people who are affected. Remember, once they become rehabilitated, let us reintegrate them into the society, let us accept them, let us live as one family. Loving, caring, and sharing what we have is the best way, and that is what we as human beings, we are expected to do. Loving, caring, and sharing are the foundations of humanity. Thank you very much. In case you need our services, we are at Wetavia House in Thika Town. We at Uhai Center, we offer consultancy services on mental health issues, psychological wellness, alcohol, drug, and substance abuse prevention, treatment, as well as rehabilitation and reintegration. We offer mentorship and career guidance. We are open to conduct corporate trainings to all corporate institutions. Please reach out to us on our social media. Find us on Facebook, YouTube, LinkedIn, all under one social media handle, Kibe Edwin Getao. Kibe Edwin Getao. Also, you can follow us. You can see our website, www.uhaicenter.com. www.uhaicenter.com. Let's journey together. We are better together. Thank you very much.